where we were just kind of talking in between the break, Bree, I just feel like we done pretty good stepping up our role as far as like trying to really plead with the people to take this thing serious. I mean, going back to stay home.
He's still doing it too. Gotta.
703. Let's go get Dr. Hoa Nguyen of the Physicians Advisory Group. He's the chairman, and usually when we get him on this early, he's at the house, right? But so I'm kind of nervous that you're up and heading to the clinic at 7 a.m., Doc, and then I know you must have had a rough night with 130 positives. We had, over about a dozen hospital admissions yesterday with COVID positive patients.
We saw an increase in the people that are receiving an ICU level of care. And we're just talking about GMH. Gosh, there's 7 people, I want to say, at GRMC.
Right.
That's an increase, too.
Naval Hospital, they got someone on the vent there. GMH, the number of patients on the ventilator went up. And we know that from what Lillian Posada said, sadly, so tragic, there's only been one patient to come off that vent and walk away from COVID. And that was way back in the first wave. So, Doc, we're bringing you on here, and we'll just start with the first question. Is it getting worse?
Yeah, things are getting worse. It's not getting better. There's a lot of factor behind it. And I think the main thing is that everyone kind of tired, stay home. It's been 7-8 months, and they keep planning, get together to celebrate things, and I'm not quite sure why they do that. But we need everyone responsibility again to get over this thing. And I still hear from my patient that they plan to celebrate the mom birthday and the father birthday and get together, and that's a lot of problem. So I think that the people just need to we got to come up to a holiday season and try to get better so we can somewhat have a normal holiday. But Thanksgiving, Christmas, everything coming up here, and people are not be reasonable and be responsible. This is our Christmas. It'll be like this. So we have some time there for adjust ourselves and try to get better. Unfortunately, the hospital admission going to be about 2 weeks behind, and we will see hospitalization going to go up. So we got to be look at the situation very carefully on everyone. Every person on this island needs to be on it. So there's the clinic, the hospital, public health, everyone have to be kind of do their part and try to move us forward. But we didn't have a packed meeting last night just because I had to be at the legislature
Right.
hearing with the senator yesterday.
Right.
So
I want to talk about that, Dr. Hoa. That hearing yesterday, there were multiple hearings, but the part that I caught on was the discussions on the process for isolation and the difference in monitoring between those that are on home isolation and those that are in government isolation, right? In the government isolation facility. And so there was one thing that you had mentioned with regard to that was that the people that are in the government isolation facility are more of the healthier people, the people that don't have necessarily the comorbidities. The people that do have the comorbidities are the ones that are in home isolation. And so the monitoring is different. Whereas in the government isolation facility, you get, the temperature checks and all of that stuff. But when you're on home isolation, you get at least 2 phone calls a day from a public health. And you had mentioned that what you think should happen is this COVID clinic, right, should be established. Can you tell us a little bit more about that?
People most people think that when we go into isolation facility, those are the high-risk people that we monitor. And I think a lot of people think that way. No, the isolation facility is for mostly for younger people, for people that have no comorbidity that will go there to protect their family at home. They might be in a household that have other people that have hypertension, diabetes, cholesterol at home, and they don't want to give to those the family, so they move themselves to isolation facility. So, isolation facilities serve a purpose. Serve a purpose of isolate those positive patients and get them away from the rest of the family. So it does have a very valid point to have one, because if not, the whole family going to get it. So, and now the one that decide to isolate at home, mostly the one that have comorbidity, they don't want to go to isolation facility because they are at home already, and maybe the rest of them are younger, and so and they just put themselves in the room and stay in the room, and that is a safe environment also for the household. Just because if you can separate yourself from other people, you won't give to other people. But the problem is that we don't have a very good system, and it's not just one. Everyone else the same. We don't have a good system to really monitor those people for make sure that they don't deteriorate at home to the point where they get in trouble or they show up in the emergency room dead on arrival. That's what we have seen lately. That people are showing up already expired already. And a phone call twice a day and ask people for their symptom is not going to be enough because people wait to the last minute. And there's such thing as this COVID-19. What it does is called a silent. I mean that your oxygen level in your blood drops so low, but you don't have any symptom, until it gets to super low level, and it's too late already. And that's what people stay at home are missing, because they think they do well, and a few hours later they can't breathe.
Yeah.
So we have to come up with something that not for every COVID-19 positive patient to go to, but only the one who are identified to have high comorbidity, that have multiple chronic illness, because they need to have a place somewhere that they go almost on a daily basis to be checked with a provider to make sure they're doing okay. There's a lot of things we can do pre-hospital that we can intervene. You need to monitor the pulse ox, which I mentioned that we can buy those little pulse ox you clip your finger, and they're cheap. We can buy them and pass it on to those high comorbidities so they can check the oxygen at home, and you can instruct them how to do that. And when they recover or they get out of isolation, they
using his data. Sorry, Doc, you you froze. Yeah.
Hit a dead spot. We'll just
There
go.
you are. There you
Okay.
go.
Wait, no, sorry. Okay. Good.
All right, Doc.
yeah,
You were
you
talking
can do a
about
chest. Yeah, go ahead.
no. You were talking about a piece of equipment or something that the government, I guess, could purchase
Not
and give it to.
those little pulse ox, those little tiny. It's like $20 or less. It's cheap. It's not expensive, and that's try to push and to get something that let's say that you test positive in my clinic and you have comorbidity. I will call you before I leave. I let you go home. I say we have an appointment with this clinic the next day. Okay, so that way you can show up in that clinic, and they give you more education. They check up on you, and that's due daily. And then you take about 5 to 10 days for that for the patient to come by, but at least you keep a very close eye on them. And if they don't have a ride, provide them transportation. It's a much cheaper alternative than have them admit to the hospital. So and to save life. Clinic like that already stand up in the state. So that thing that it's not just something that we think about here, but they are doing something else everywhere else, just because they want to keep a close eye on those people at home. So that's what our idea last night, and that's Senator Therese Talahi was putting together, and I hope that it does happen. I don't know where it's going to be. It's going to be a very interesting clinic, to work in, because all you're dealing with is COVID-19 positive patient.
Is this something that it has to be legislated, or is this something that the governor can establish and designate a specific clinic to just be? No, I mean, right?
It's I don't know. Probably someone can do that, but it's very challenging because it does cost a lot to stand up this clinic. Not as cost as much as the hospitalization, but you got to be train your staff well. We got to protect ourselves well, because the chance of the staff that work in that clinic turn positive very high. Because you're dealing with this positive patient every day. So yeah, I mean it'd be nice to have support from the legislature, nice support from the government, just to stand this up. It's for the people, and I think that there should be some funds for that clinic.
As in CARES funds, or what sort of funds are we talking about?
Really, I don't know,
Okay.
Sabrina. I mean, that's the thing that it to come up with somewhere, for like say, the worst thing that the physician can tell the patient is go home and wait. And they all ask, what can I take? So it's just that they need somewhere where they can go, they can feel confident. They don't want to go to the hospital. I tell you, the patient wait till the last minute to go to the hospital. So, and that's when they get in trouble.
So this idea was brought to the legislature yesterday. Has this also been brought to the attention of the governor, that we need this, that we should implement this?
We talked very briefly with a group of physicians. Like I said, discuss this in an open way yet. So I think Thursday we're going to really talk about on the PAC, and then we will ask the governor. I mean, we brought it up maybe once, but it's very brief, and I didn't think much about it. But it's a lot of people now DOA, so we really have to think about that very hard.
Out of the more than 1,400 people that are in isolation, whether it be government isolation or home isolation, do we know how many have comorbidities?
I don't think I'm not sure they keep a statistic of that or not, but luckily the majority of them are young people. As you can see, the graph there for the age group, most of them are very young. So we talk about not too many of this 50, 60, 70 years old that have comorbidity. So it's manageable if you do it right. And sure, that statistic, we know in our clinic who have high comorbidity, and we can tabulate that, and we know exactly who it is. We keep an eye on them a lot closer.
Doc, I know you guys didn't have the PAG meeting last night, but I just got to ask, have you heard, or is the Physicians Advisory Group advising any easing of restrictions this week, or are they advising any tightening of restrictions or allowances that are in place?
I don't know. I feel like we should be the same. It's just the rate go up so much. When we are at 130, I don't see any downward trend at this point. So we really have to, be very careful and keep reminding people, especially the home situation and especially the work situation. We work with everyone on the business already. Try to remind the people that if you're sick, stay home, because we still see people that are sick and still go to work. It's a lot of things that anyone can do to make sure that we slow down this virus here. And if you're sick, you really stay home and don't go to work. The employer should understand, and they all say they should understand. So that shouldn't be a problem. But well, one thing I want to mention, and it's very, very important for people to understand, and again, all COVID-19 testing, if you're symptomatic or you're close contact or whatever, is absolutely supposed to be free. Okay, no one should pay anything. So that message had to come across. The only way that you can pay for anything for COVID-19 testing, if you're a company that want to clear the people, or you are travel somewhere, that's a requirement for your travel. But anything else that relates to Guam here, sick visit, close contact, whatever, if you stay in Guam, it's going to be free. So no clinic should be charged for it. So I want to pass the message to people that come on, if you want to get tested because you think you come in close contact with someone, are you sick or anything, please access the clinic. It's free. You shouldn't be charging anything. If you get charged, I don't know, you can call me and I will try to handle it. But you should be free to everybody. It's highly encouraged, but that's how catch the people.
Right.
Okay.
It should be free. So you're basically saying if you don't feel well, you have the symptoms, or you came into close contact with a positive, you can go to the private clinic, even if you don't have insurance, and get a free COVID-19 test. Is that what you're saying?
Yes. Yes, Chris, you do. Yeah, you guys been through before, and you didn't collect anything at all. Yeah. It should be transferred. There's nothing at all, so you don't have to worry about paying anything. And the key here, but when you go, be patient. Clinic can do so much, right? I mean, we can swap in amount, so the wait time might be a bit longer, but we will try to make room to test you at every clinic if we can. Okay, but no one should be charged for anything at all. Okay, if you're sick, especially you're sick, man, you want to catch that. So go to clinic, say that you're sick, just wait. Your turn will come, they will swap you. We want to know that. So, and I don't know, I still hear clinic charge people, and I just don't understand it.
Yeah, I just got a message that FHP is charging people.
Yeah, it's frustrating. We can't. We don't know how to tell people.
Maybe that's something you could bring up during the physicians advisory group meeting. I don't.
Yeah, we can control the little private clinic, but I have family the other day that test one positive, and they going to try to make an appointment. Another clinic that charge them, and just come. We see you. We swap you. The whole family come, and it's all free. They don't pay one single penny. They walk in, they walk out, and 4 of them are positive. So it's something that I don't know. It's bothered me to see someone that charge somebody when they sick on this type of COVID-19 pandemic. So again, that message needs to go out to people. So they should question why I pay for that. Okay.
All
right, Doc. Anything in closing here before we let you go?
Yeah, just be safe, everyone. This whole island of Guam is our home, and be responsible. Do not have the family gathering. I know that you miss everyone, but we want to make it better. So by the time this holiday comes, that we can enjoy a whole lot more than what we did right now. So
don't give us false hope, Doc. I already told my kids that the governor canceled Christmas.
Okay, it's not that. It's just that we want to get better. Okay.
Yeah.
Mm-hmm.
So wash your hand, wear your mask, social distance, and everyone be fine. Okay.
All right. Thanks, you, Doc. Look forward to hearing more about this COVID clinic when we talk next time.
Yeah.
Okay, bye-bye.
Keep us posted, Doc. And hey, let me know about that patient.
Okay.
Okay.
Oh, yeah, that's out who that is. Okay.
Yeah.
Okay, thank you so much. Okay.
Doc, help yourself. I know you're on a strict diet, but we actually have virtual masubi.
No, we got the Navy biscuits.
Oh, and we have the Navy biscuits here. I don't know if you're a fan of the Navy biscuits, the ship biscuit. the denture checker.
Well, he was in the airport,
Okay.
so maybe.
Yeah. So, Doc, if you want to grab some of that on your way out, maybe for some of the staff, feel free to. Okay.
Okay. Okay. Thank you,
All
guys.
right.
Thank you, Doc.
Okay.
Okay.
Bye.
There you go.
Have a
All right.
nice
Yeah, Doc's clinic is AMC. We had a comment here.